Good afternoon, students. My name is JEEVAN. I have taken you the Community Health Nursing Unit number 4, Epidemiology and the Nursing Management of Common Communicable Diseases. As in the first class, we have learned the epidemiology definition, communicable period, and some terminologies and all, and the mode of transmissions. And in the second class, we have learned about the type of communicable diseases depending upon the sources. In that one, first one we learn about the respiratory infections. In second one, intestinal. Then third, anthropometric, and fourth one is viral infections. That first, respiratory infections: smallpox, chickenpox, measles, influenza, rubella, acute respiratory infection to the pneumonia, mumps, diphtheria, whooping cough, meningococcal meningitis, tuberculosis, and SARS. And in the last class, we have studied detail about what is smallpox and chickenpox. And the continuation towards that class is the third one is measles. So measles, it's a communicable diseases. It is also known as rubeola. It occurs in children in the age group of 3 to 5 years. And what about the incubation period? Means 8 to 14 days. The causative organism is rubeola virus. As per the causative organism, that is virus, rubeola virus, it has named as measles, is otherwise known as rubeola. Then what is the mode of transmission? Means it can be spread through the droplet infection or to the person to person contact. Then what about the signs and symptoms? Signs and symptoms in the picture image, it is showing that the person is having the high fever, red eyes. Then second one is a running nose and the cough. Then third, muscle ache, or that is pain. Body pain will be there, and the sore throat also is there. So symptoms of the measles, that it says that in the image we can see the high fever is there, redness of the eyes, then running nose, cough, muscle ache, that means muscle pain, sore throat. So as here, it is the signs and symptoms is divided into stages. Stage 1 and stage 2. Stage 1 is otherwise called a catral stage, and stage 2 we are calling a stage of eruption. So we'll learn firstly what about the stage 1, what it consisting of. So what is that means? It is in the stage 1, the patient will be having the clinical manifestation of fever, running nose, cough, appearance of red spot in the mouth, and watering of eyes. So these are the signs and symptoms which is showing in the stage 1. Stage 1 is otherwise known as catral stage. In this stage, the patient will be exhibiting the signs and symptoms of fever, running nose, cough, appearance of red spot in the mouth, and watering of eyes. And we'll go for seeing what is stage 2. The other name of the stage 2 is stage of eruption. So here the redness seen at the back of the red rashes we can see. So wherever we can see the red rashes means back of the ear and forehead along the hairlines. In the hairlines also we can see the red rashes. So first of all, the red rashes will be forming at the back of the ears, then forehead, along the hair lines and all. And then what happened to this red rashes? This red rashes will be spreading all over the body. So that is stage 2. The stage 2 is otherwise known as stage of eruption. The red rashes will be forming. First and all, the red rashes will be forming in the back of the ears, then forehead, along the hairlines also. In the hair lining also it is red rashes will be forming, and later it will be spreading to all over the body. So that's about the signs and symptoms is divided as stage 1 and stage 2. Then we can see the prevention. So prevention is divided into two categories, that is active immunization and passive immunization. Active immunization, what it says that by giving live attenuated measles virus over a 1 year of age, or we can give at the month of 9 months, or within the 1 year we can give the active immunizations. So active immunization, that is measles, we can give by the live active, that is what is active means by live activated measles we can able to give measles virus, so over the 1 year of age or at the month of 9 months in the form of MMR vaccination we can give. Okay. The second one is passive immunization. So passive, by the human normal immunoglobulin, by giving the human normal immunoglobulin we can give as in the form of passive immunization. Next one is control. How we can able to control the measles. So once the person is having the measles, we should isolate the patients. Isolate the patients for 7 days after onset of rashes. Isolation we should give first. Second one, so those who are having the contact with the particular patient, so we should make the patient to become other person, non-infected person, to immunize. The third one, so whatever the articles they are using, which patient is using, we should disinfect properly. So these are the controlling measures we are using in case of measles. So once more we'll see. So measles is otherwise known as rubeola because of the name of the causative organism is rubeola virus. Because of that one only measles is known as rubeola, and it usually occurs in the age group of 3 to 5 years. Incubation period is 8 to 14 days. Then mode of transmission is droplet infection or to person contact, and the signs and symptoms is divided dividing as stage 1 and stage 2. Stage 1 indicating as scatral and stage 2 is stage of eruption. Then prevention, it is categorized as immunization and immunization, that is active and passive form. How we can control the measles means the patient should be isolated to for the 7 days after the onset of the rashes, and whatever the utensils the patient has used, we should make clean properly. Then whoever is contact with the particular patient, we should tell the person to go for taking the immunizations. Then the fourth one, influenza vaccination. Influenza. So what is influenza? Influenza is also known as flu. It is maybe as acute form or highly infectious diseases towards the respiratory tract. Usually it will be occurs in all the age groups. So this influenza, what is the introduction part here means, it is otherwise known as flu. So it can be occur as acute or chronic stage. That is, it is becoming as a acute or a highly infectious diseases to which system means respiratory system, that is towards the respiratory tract. So in all the which age group is means, so all the it can be, this influenza can be occurred in all the age groups. So next one is incubation period. It can take about 1 to 2 days or to 24 to 48 hours. Then causative organism is categorized as A, B, C. The influenza virus A, influenza virus B, and influenza virus C. So these three type of virus can occur the influenza or flu. The next one is mode of transmission. Mode of transmission, the influenza is mainly spread by droplet infection. Then second one is freshly contaminated formats, that is freshly contaminated objects. Then third one is direct contact, that is person to person contact will be there. So mode of transmission is droplet infection, then freshly contaminated object or a formats, then direct contact, that is person to person contact. Then next heading is symptoms. So what are the symptoms will be there towards the flu? Running nose, then fever, chills, stuffy nose will be there, then sore throat, then body pain or body ache, cough, fatigue, headache. So these are the main things will be occurring towards the flu patient. So usually the person will be getting the running nose, fever, chills, stuffy nose, sore throat, body ache, cough, fatigue and headache. So in these symptoms, most severe is fever will be there and stuffy nose will be there, sore throat also will be there, cough and headaches. So these are the red letters, it becoming as in the form of chronic one. Then next one is prevention and control. How we can prevent the influenza or flu. First one, by administering polyvalent influenza vaccination. So influenza virus vaccination we can able to give. So immunization, that is immunization we can give to go for preventing the influenza or flu. Second one, we should isolate the suspected case. If the person is showing that he is having body pain or fever is there, so in the initial stage the person will be having all those things, so we can make the person as a suspected case. So this suspected case we can make as a separation or isolate the person. Third one is spitting in public places should be avoided. So those who are having this type of problems, symptoms is there, means once they are spitting, after the coughing maybe they will be having the sputum. So if they are spitting outside, what happened? This virus or the bacterial, it can able to spread towards the other person. So make sure that we should avoid spitting in a public places. Then next, we should give the health education regarding the healthy habits. So one bad habit is spitting in the public places. So as we are giving the health education about the healthy habits, we should strictly instruct the patient avoid the spitting in the public places. So this is the prevention and controlling. So then we'll go for seeing the treatments. So once in the suspected case, the person will be having the fever. So if the fever is increasing, so tell the patient to take the bed rest thoroughly and drink lot of water. And then second one is analgesis. So especially we are giving the paracetamol only here. Then dry cough suppressant also we can give. Nose capin we can able to go for giving. Then antiviral. So as per the doctor's prescription, we can give the antiviral medications. For example is Fluvir. So Fluvir is in the dosage of 75 mg and to 150 mg and all. So we can, as per the doctor's order only, we can give the dosage also. So antiviral administration, that is for example Fluvir. So once more we'll see influenza introduction, that is its other name is flu only. So it may be as a acute stage or towards the highly infectious stage. It will be affected towards which system is respiratory system. It can affect to all the age groups and all. Then what is the incubation period is 1 to 2 days. Then causative organism is ABC virus, influenza virus. Mode of transmission is droplet infection. Then freshly contaminated objects and all. Then direct contact, that is person to person contact. Then symptoms is running nose, fever, chills, stuffy nose, sore throat, body pain, cough, fatigue, headache. And next one is prevention and control. So how we can able to prevent the influenza? So by giving the vaccination we can prevent. Then second one is isolation. So once the person is a suspected case, if they are showing any symptoms of the flu, it becoming as a suspected case. So this suspected person we can able to make as a separation or isolation. Then tell the patient to avoid the spitting in the public places and all. And fourth one is, as a nurse or a health worker, we should give the health education about the healthy habits. And here we can tell the patient or educate the patient strictly avoid the spitting in the public places. Then treatment. Bed rest will go for telling. So bed rest until the fever was subsiding. Then anyway the patient is having the body pain and all, so we are giving the analgesic paracetamol we can give, that is for dolo 650 also we can able to administer as per the doctor's order, because it consisting of the combination of analgesia and antipyretic. Then third one, dry cough. Because of the cough we can able to give the dry cough suppressant we can give, noscapine we can give. Then antiviral administration as per the doctor's order. So for example is Fluvier we can give. Fluvier is in the dosage of 75 mg and to 150 mg are there. So as per the doctor's order we can able to give as either to 75 mg or towards the 150 mg. The next one is rubella. So rubella, it also here rubella calling as German measles or the 3 days measles. So it is very contagious diseases that is will be affecting towards the children. So the other name of rubella is German measles or towards only the 3 days measles. So it is very dangerous or contagious diseases. It mostly affected towards the children. So what is the incubation period is there means maybe as a 12 days to 23 days. And also what is the causative organism? So caused by the virus, that is German measles virus. So and it will be having the more risk towards the first trimester pregnancy women. So pregnancy, so in the first trimester means first 3 months in the pregnancy time. So it is very highly risk towards the pregnant mothers and all. Then mode of transmission, it is caused by mode of transmission of droplet infections. Then we'll see what are the signs and symptoms. So first one is mild fever. It is from the 99 degree Fahrenheit to 100 degree Fahrenheit. Second one is swollen and pink colored eyes. That is it can leading towards the conjunctivitis. Then headache, swollen glands behind, especially this swollen glands or enlargement of the glands we can see behind the ears or on the neck. Then stuffy and runny nose. Then cough, sore joint, especially this sore joint we can see in common towards the young women and all. Then general discomforts. Then the last one is lymph node may be swollen and enlarged. That is same thing, swollen glands behind the ears on the or on the neck. So what are the signs and symptoms for the rubella is mild fever. So mild fever means indicating for the temperature of 99 degree Fahrenheit to 100 degree Fahrenheit, and maybe the eyes become as swollen or pinkish in color, which can leading towards the conjunctivitis. Then third one is headache we can see. Then lymph node enlargement. So maybe we can see under the while doing the physical examination we can understand there is a swollen glands behind the ears or on the necks. Then stuffy and running nose. Then cough, sore joint, especially we can see in the young women, and general discomforts. So then investigation with the help of blood test we can understand. Then especially we are doing the throat or nasal swab culture test for investigating the rubella. Then urine samples. Then complication, I have told it is very risky towards the first trimester of pregnancies. So even the mother had the rubella. So what happened towards the baby means uteroplacental effect itself. The baby will be getting the rubella. So once the baby is born with the birth defect only, if the mother had the rubella. So what happened here means the baby has born with a birth defect. We are calling as congenital rubella syndrome. Already the mother had the rubella, and this rubella will be passing towards the unborn baby through the uteroplacental way. So once the baby has born, so once baby born, this baby is having the birth defect will be there. So we are calling that as a congenital rubella syndrome, CRS. So what will be the features of the CRS? CRS means congenital rubella syndrome. So what will be the clinical manifestation towards the CRS means, first one is heart defect will be there, cataract will be there, deafness, delayed learning, liver and spleen damage, diabetes and thyroid problem. So these are the features it was showing towards showed by a congenital rubella syndrome. Okay, so if the mother had the rubella, the pregnant mother had the rubella, so what happened, this rubella will be transferred towards the unborn baby through the uteroplacental way. So once the baby has born, surely the baby will be having the birth defect. So with the rubella, so what happened means we are calling that one as congenital rubella syndrome, or that is short form as CRS. So what are the features, clinical features it is showing means heart defect will be there, cataract, deafness, delayed learning, liver and spleen damage, diabetes and the thyroid problem. Then last, how we can able to go for prevent. So child we are giving, so for the normal children we can give the 2 doses of MMR vaccination. I have told before is of measles also we has given the vaccination. MMR, mumps, measles, so it is a combination vaccine that is mumps, measles and rubella. So in the month of 9 months up to the 1 year, so in between that one we can able to go for giving the MMR vaccination. So as per the schedule it was giving in the month of 9th month of the baby. Then we are giving the 2 doses. First dose is in the 9th month or towards the one in between within the 1 year, and next we should give in the 4 years and 6 years, in between to 4 years and 6 years. Then treatment, for the children we are giving acetaminophen, that is paracetamol, or to brufen we can able to give. And next one is pregnancy. Towards the pregnancy, as per the doctor they can able to give antibiotics. So antibodies we can able to call as a hyperimmune globulin to help the body to fight against the virus. So towards the pregnant ladies, what is the treatment we can give means, as per the doctor's order it is to take the antibodies we are calling as a hyperimmune globulin to help your body to fight against the virus. So this much. So rubella introduction I have started, germ, measles and causative organism. The risk especially towards the first trimester of the pregnancy, mode of transmission is droplet infection. They will be having the signs and symptoms and all. So mild fever will be there, conjunctivitis, then headache, then lymph node enlargement, cough, sore joint will be there, general discomfort. Then investigation, especially we are doing the throat and nasal swab culture test for the understanding which type of virus it was. Then complication. So as I have told in the risk area, especially risk towards the first trimester of the pregnancy. If the mother had the rubella towards the any other trimester, it can able to transfer towards the unborn baby through the uteroplacental way. So once that type of baby is born means we can make as it becoming as a birth defect. We are calling as congenital rubella syndrome, CRS. It's having the clinical features of heart defect, cataract, deafness, delayed learning, liver and spleen damage, diabetes, throat problems, thyroid problems and all. And how we can prevent means with the help of administering the MMR vaccination. So it is 2 doses is there. First dose in the month of 9 months or within the 1 year we can able to give, or some cases under we can give up to for 15 months also. So in second It is between the 4 years to 6 years. Then treatment is for the children we can able to give as brufen or acetaminophen, so that is paracetamol. Then in case of pregnancy, as per the doctor's order, antibodies we can able to give, that is hyperimmune immunoglobulin, that is the hyperimmunoglobulin only we can give for fighting against the virus. So up to this much you may be understood. So we has learned the respiratory infections. So five I think from we have studied about from the 1, 2, 3, 4, 5 up to 5 we has learned. That is, first one is smallpox, second one is chickenpox, 3 measles, fourth one is influenza, and the fifth one is rubella. Hope I think you all understood. So, and next class we'll go for dealing with the other type of